stomp his foot, bark at me. I refuse to discuss this matter. Adamant. Spin on his heels and leave the exam room. And wait a good 10 to 15 minutes for me to pull my heels to bring it down when I just asked a question. And I'm okay with that. He was the one that had the issue with it.
Yeah.
So I would ask again. Oh, same response. Okay. A few more times, not all in run, spread out, you know, with colds and flu and all that stuff. Each time I got the same exact response, which just taught me he was taught that response. And when I asked a couple of the other physicians and got the same response in the practice, I realized, well, they're being protected by
They just refuse
by
to
their
talk about
attorneys.
cannabis completely?
Yeah, they're involved with the hospital and they're told whatever along the line. And I can understand that because even when I'm over in Philadelphia, the door gets closed when we talk about it. He's not allowed to talk about it either with me. However, personally, one-to-one, he's constantly asking me and bringing patients to me to help sign up in the program with the MMP program in New Jersey. I went online. I not only researched it, I wrote a paper about chronic pain in cannabis. And in 07, 08, I was getting really, really bad then. I needed 2 of the strong crutches to ambulate, and most of the day was involved with, you were talking about the Charlie horses, pretty much going through my legs and what goes with that. I'll just leave it at that.
Yes.
It wasn't fun. We ended up on the, similar to Medicaid, the federal program, options, or global options. And that got people to be able to come to my house to be able to take care of and help clean, cook, and bathe and all that stuff at that time.
So
this
Michael,
was in 09,
Yeah.
010.
That's
Sure, please.
Can I just
Using
clarify one thing
cannabis
for me?
at that point came right after
Were you
that.
using cannabis at all at this time with
No.
the doctor? So
No, I'd still been researching. I hadn't used cannabis since I was 29, 30 years old.
Yeah.
You know?
So
It was a pretty much regular thing from 12 until then, but after that, you know, I had a kid and then I got a job that required a tie, and it wasn't so much about it being tested.
Right.
It was about, okay, that old mythology of, yeah, there's the stigma again,
Yeah.
that I had accepted, that I've been thrown the stoner stuff, and yet, you know, just to be clear, there's never been one fact, a stupor, or, you know, any kind of activity that a cannabis user is a, quote, the stereotypical stoner doper. My life did not turn into a Cheech and Chong movie when I picked up. My life also revolves, yeah, a long time with this, but, you know, within a matter of several months, the turnaround was amazing.
So Michael, the program comes online in 2012 over Governor Christie's staunch objections.
In 2010, I got to give testimony, and then after giving testimony, it was, okay, it's going to come online, but then seeing, all of a sudden, when Governor Christie gets involved and signs something in, he can't stop writing. And we just recently, last month, had the PTSD added to coma.
Yeah.
And thank God for that. However, yeah, the governor kept writing.
Yes.
And at midnight, at 12:01 a.m., it was going to become law anyway. So in the evening, he got to writing and added some. Now, all of a sudden, it has to be the last effort rather than the first effort. And I think this is something as far as harm, and that's my, you know, position there. But to get on New Jersey's thing, to be able to meet that, yeah, the intractable muscular spasticity is what qualified me for it. About 68% of the patients that are on there now are under that diagnosis.
Just to qualify that, I know we don't have a New Jersey, so I don't know all of the New Jersey.
Yeah, so to say,
So there, so I mean, it's also on the website, but there's, you know, the 10 that are in New York State, plus 5 associated symptoms. We're hearing also, you know, symptoms of pain, but there's also nausea, there's also cachexia, wasting, seizures, besides also pain.
ALS.
No, so we're talking about there's a
Jersey.
five. Oh, okay, New Jersey.
Yeah.
Yeah,
So,
they're different.
and then there's
They're different.
other differences as well. In New Jersey, you have the smokable, you're allowed to smoke and you have
Flowers.
edibles.
We have flowers and no edibles. Now
No.
it's just
Not
recent.
yet.
At Belmar, we have a tincture available. It's a CO2 process extracted and then mixed with glycerin.
Yeah.
One unit is I think 100 milligrams.
Yeah.
So let's take it back,
So go
Mike.
ahead.
Well,
I'm
so
sorry,
the reason I
just-
made this point is because in New York, we don't have any smokable
Right,
forms. You
right.
have tinctures,
No
you have
flower.
oils, you have vaporization, again, they're oils. And so there's that difference in terms of the route of administration. And, the only other state that has that same regulation is Minnesota.
Correct.
So that's why it's also
Efficacy
been
can
very,
still be borne out.
difficult for registered organizations in
So we
terms
got a
of
lot of work
getting
to do, buddy.
vaporization
You
and
gotta
getting
get
all the
flowers.
forms.
Also the added
Efficacy
expense
of
of
where
the
the
concentrates and all the other.
Efficacy
Yeah.
of concentrates and things, so understand that also to get onto the program, because of my disability and being on Social Security disability and my income being so low, I qualify for the $20
Good for
fee,
you.
Whereas the standard fee is $200.
Now, is that
Don't,
a
which is
state
prohibited.
regulation or is that a
That's-
dispensary?
Remember when the government kept
State
writing?
for New Jersey.
He added that on
Kuma
there.
was fined back in 2009 when I gave my testimony, chronic pain. Yeah, 5 minutes before if you can look up my testimony, online, you can tell by the excitement in my voice. 5 minutes before I got called up, I was told that chronic pain had been cut out.
Right, so just
That's
to-
my whole thing is like,
just
what
to
am I
clarify in
doing?
terms of why we're, pointing out the differences in New York State and New Jersey is because each state has their own laws and their own regulations, and the person who qualifies in New York State has to be a resident of New York State, their physician who's recommending New York State, and also the dispensary, the registered organization has to be within state lines. There is a caveat where you can cross the state line if your practitioner, not necessarily cannabis medicine, but your care is being given. So certainly there are people who are from New Jersey who go to, say, Memorial Sloan Kettering for cancer care. If their physician is a New York State physician and I'm in New York State, and even though they're in New Jersey, they can get the certification. However, in terms of state lines, you're not supposed to bring it back.
So they can only use it in.
In-
Well, I mean, so
Right.
that's a technicality that when I brought it up to.
Yes.
Hold on, this is really
So it's a little bit
important.
confusing of how to
This
get
is-
around that.
This is an important national thing that's happening right now,
Right.
where medical patients are not given access to their medicine. This is going all the way down the corridor in Denver. I mean, in Colorado right now, where, Colorado, obviously a totally different state now, and, but because of their home rule, each little municipality got to vote on what they would accept, whether it's flower or not, but the patients to be able to afford it to grow their own plants.
Correct. Yeah.
Okay, this is something that was in Kuma to be able to start out 6 plants. That got recommended by the Penn. But what's happening right now is because of this, you have patients that need several different strains to be able to handle the
Medication.
treatment
Yeah.
of the symptoms that they're going through. But they have to rotate this because the endocannabinoid system
Gets used to
needs
it.
to be changed up. Okay,
And
so to mix that. What's happening is because of the local municipalities, they can't get to it. Just like you were saying, we can't get to our medicine. In New Jersey, I can't grow my strains
Yeah.
at all.
Although, what she's about to say, New York also is going to maybe allow delivery, so we have to wait and see that happen. That's what they said, that's what they said.
So Michael, take us back. So in 2008, doctor planted a seed and said you should consider cannabis, but it wasn't legal, and so you did your research.
I did my
And then
research and
2012
as far as me
program
getting
came online?
involved with this.
Yes, how did you find a doctor?
Well, what happened during that time period is I had 3 boys. And my son Ryan was 21 years old, and he's looking at my papers and research stacked up, and he was congratulating me. He goes, "Dad, you've done some good work here." He goes, "I know the doctors." He is the one that was driving me to get the procedures done. he just goes, you know, when you're ready for it, and I just stood a joint across the coffee table. He goes, I think you're ready to get started when you're ready. And I've been using therapeutic yoga for 20 years, and that joint went into a pranayama meditation center. It was just, thank you.
So how
Why
did
did you-
that translate into being
So that
part
translated
of
to
the program?
more of my own.
Yeah.
Now I'm pushing my doctors.
Good.
Now I'm looking and
Find better doctors.
when I went to state, I met these guys that came up and they had these pins on, and I didn't know what they were. The reason I believe I got chosen first to give testimony at the State House was because I didn't have an axe to grind. No one knew me. No one recognized me, and I just showed up by myself. I printed up my testimony, I called in, I did it all myself. I called my legislatures, like I'm saying. I had conversation with every one of my doctors. I discount any idea of a stigma with this. And we're
Tell me how you
challenging.
found the doctor that certified you.
Fortunately, in New Jersey, the New Jersey Department of Health has a website,
Ah.
and you go to that and you see New Jersey MMP, Medical Marijuana Program. You click on that, there's patient use. You click on it, oh wow, here it is, step-by-step instructions
Ah.
on what you need to do. It comes out very much like this is from our dispensary, but it tells you how to do it. And then, what do I need? What else do I need? What does it cost? It all is broken down. And then for doctors, you can look at individual towns or counties. I cross-referenced both because the county is going to cast a wider net, and then I did my town. And here's this one guy who's right around the corner. And
God, I wish I had it that easy.
you know something? Let me just start with him.
Crap.
And I was already made a decision that my GP obviously wasn't budging with this, and he couldn't. And I'm not in any position to twist arms, and rather part as friends. And he was retiring, and so I took advantage of his retirement, and interviewed 3 of his other doctors and got the same result, and realized that wasn't my practice anymore. And Dr. James Crudell in Morristown, Church Street, became. I made an appointment. I needed a GP. Because of my rather complicated, extensive medical history, we had a nice conversation about it. And,
How many visits did it require?
well, hold on a second. This is visit number 1, where we were done. Okay, GP, and is there anything else I can help you with while you're here today? This goes back to earlier what I said. Yes, doctor. I got online in the State Department of Health, and I saw your name was on the list with. And his eyes rolled up in his head, and this is where the response was, had we known that they were going to publish our names, we never would have gotten involved with this. And then he stopped, and he said, I'm sorry, let me explain this. And so what he told me was that he had 3 of his other patients that had been with him for a few decades, brought it to his attention, and it's something that worked, and they were using gray market from their family from out west. And so he saw it was working right in front of him. He knew these people, and he had to agree with it. And he looked at me and goes, we just went over your medical history. I already know you qualify. He goes, I stopped taking new patients. And I said, well, what would you like me to do?
Yeah.
He goes, the computer's right here. All I got to do is do this. There, you're in.
Really?
So were you able to?
Now, here's your recommendation. It printed up. And now,
Were you able to take that recommendation directly into a dispensary?
Well, at that time, see now, hold on now. This didn't happen until 2012.
Still.
Okay, there's still some time in
I
between.
should have moved to Jersey.
And what happened we had to do a year to have this goes back to your visits question. I since found out there's other ways of doing this, but Dr. Crudell didn't know that, and so we did a full year of our bona fide relationship, doctor-patient relationship.
Before he would even certify you.
Right.
Ka-ching.
And once everything was in, I was already online for my surgery, which was 2013, November, and I got my card while I was in rehab. I also got very, very close to getting thrown out of rehab
Okay.
because I'd already started self-medicating. I made a big choice. Now, by the time I was on my surgery, now hold on, I used this because for my surgery, we needed to be off all opiates.
Yeah.
I've been on 200 micrograms of fentanyl for 18 years. I've used 30 milligrams of OxyContin, codone, for whatever you want to call it, for breakthrough pain. And that's the safest medication that I am on. That I know where it's going to go when it's time to stop. I know how to titrate down. And right now I am just came off of 3 weeks from baclofen after the same amount of time,
Wow.
thanks to cannabis.
Awesome.
I was able to use the cannabis, free market, thank you God, to get my opiate level down to 0 for the surgery.
Wow.
Hey, that's awesome.
Since the surgery, I realized why I was on the opiates a long time, and although I started initially following a protocol that I found online from the MS Society of the United Kingdom, which just happens to have the highest amount of MS in the world. And so their experience was to have clear head, and I followed this basically 1 or 2 tokes every 4 to 6 hours, just like I was taking my meds. I was already on that schedule, and it's 1 or 2 hits. If I could find some CBD more enriched, the more clear-headed I was. And this is something, that I examined this and approached it as medicine, not approaching it as a way to get high on some cheap.
Right.
Obviously, it lends itself, once you're in a cannabis, so it gets better and you become a little bit more relaxed. Yeah, it's a great social additive for the room. But medicinally for the patient, the importance is being able to get access to it. And yeah, I can jump on the legalization thing and decriminalization. They need to be done together because the focus of enforcement with prohibition, if it's 21 and over, they just go to 21 and under. And forget your financial aid.
Yeah.
Forget any kind of help that you can get from later on once you're nailed with that. Let alone, it's just a racist law to begin with. Anyway, I won't get involved with that.
So let's
Tonight.
let's talk a little bit about, so we
It's
have
an
our,
obvious thing.
we find our doctors, some more easily than others. We get our cards, again, more easily than others in New Jersey. We heard from Dr. Lee how difficult the computer system is here in New York. So let's talk about, we have our card. Michael, does yours come in the mail? Does it, or is that just the printout from your
Okay,
doctor?
everything has to be done on the website with
Yeah.
New Jersey. It has to be done on a desktop. You cannot use any mobile device to access this. And they're really good right back and forth with you. Okay. To get into the dispensary,
Yes.
the card comes in the mail. And to get in the front door of the dispensary, you need the card to get access.
Now, there are how many, 2 dispensaries in Jersey operating?
No, there are 5 operating
It's
at
5?
this time.
Okay.
Okay, my experience has been with 2. I'm in South Jersey, so Egg Harbor was my
close is-
first one, which was about an hour and 20 minutes one-way drive. Now that's not traffic driving, that's getting on the expressway and cruising.
Yeah.
That's doing your
that's
70,
your
80 miles
closest.
an hour, and that's the closest. I had to come up with $200 to have my son be my caregiver to pay for his card because I couldn't make that round trip. I can make it one way, but then it would be, since I've learned a little bit more on how and where to medicate New Jersey. That's maybe another story for later on. But I couldn't make the round trip, so having him come down with me was important. Plus, I was still not too far away from surgery and all that stuff.
And now the dispensary,
Yeah, the dispensary experience was night and day between Egg Harbor and Belmar today.
so the first one that you went to was Egg Harbor?
Yes.
Egg Harbor, okay, so and your son made that trip.
Yeah.
And now how, so when he goes to the dispensary, he's dealing directly with a pharmacist in New Jersey?
No, when we go to a dispensary, you're dealing usually at the front door a retired state trooper, and then you're dealing with Egg Harbor's experience was an employee that was pretty much, it reminded me of shop in high school, where they had that door with the gate on top half and then the lower